Welcome back to Season 2 of the Equity Plus podcast from CareShare Health Alliance. I'm your host, Erin Story, Director of Communications here at CareShare. In this podcast, we take a deeper dive into the issues surrounding health equity. We're excited to start our new season off with today's episode, What Should You Know About Medicaid Expansion?, with our guest Nicholas Ricks, Director of the NC Navigator Consortium, April Morgan, Outreach and Enrollment Manager for North Carolina Community Health Center Association, and Hollis Smith, CareShare's Medicaid Expansion Outreach and Education Coordinator. Our guests have a lot of great information to share about Medicaid expansion in North Carolina. So we'll go ahead and get started with introductions.
Sure, yeah. So I'm Nicholas Ricks. I'm the director of the NC Navigator Consortium.
I'm April Morgan. I'm the Outreach and Enrollment Manager with the North Carolina Community Health Center Association.
I'm Hollis Smith. I'm the Medicaid Expansion Outreach and Education Coordinator with CareShare Health Alliance.
And thank you all for being here today. So for anyone that's unfamiliar, Nick, could you give us some background on what exactly Medicaid expansion is?
So when the Affordable Care Act was passed, it intended for each state to have Medicaid through expansion. One of the things that came down from the Supreme Court decision in 2012 was that since Medicaid is a state-based program, you can't force all states to expand it. So it gave states the option. Right now, after North Carolina expanded, there's 10 states who have not expanded Medicaid. And so the eligibility rules in North Carolina and other states who have expanded had dramatically changed. But now with Medicaid through expansion, we see individuals who are between 19 and 64, whose income is between 0 and 138% of the federal poverty level and are a North Carolina citizen or resident and a U.S. citizen, with the exception of some cases that folks who are immigrants who have been here for 5 years can be eligible, and then folks who are refugees can be eligible. But the eligibility requirements now are a lot more open than they were by far.
One thing that I can add to what Nick said, to put the 138% of the federal poverty level in numbers, that would be single adults whose annual income is approximately $20,000 or less a year. And for a family of 4, for example, it would be about $41,000 or less.
So now that we have an idea about what Medicaid expansion looks like, how could someone who thinks they may be eligible for Medicaid under expansion go about applying?
So there are a lot of ways for folks to apply for Medicaid. North Carolina uses the ePass system, which is an electronic application that folks can use. If they would like assistance applying via ePass, they can contact a navigator from the North Carolina Navigator Consortium or a CAC, that's a certified application counselor at a community health center. And to get connected to an appointment, they can call the Navigator number, which is 855-733-3711. Navigators provide unbiased assistance in applying for Medicaid and marketplace insurance, so insurance on healthcare.gov, and can really walk folks through the process. So folks can have a virtual appointment or a phone appointment or an in-person appointment to get assistance with an ePass application. If an applicant doesn't want to go through ePass, there is also an option of calling their local DSS office. The Department of Social Services is the organization that sort of manages Medicaid applications, and they can receive assistance applying over the phone through DSS. They can also print out a paper application and mail it to their DSS office. But ePass is the most preferable. That'll lead to the quickest processing time.
So since Hollis brought up enrollment assisters, let's hear a little bit more about that. Nick, could you start by telling us about navigators and what it would be like for someone to work with a navigator to apply for Medicaid?
Yeah, no, absolutely. So we always try to make sure that folks are aware of navigators and certified application counselors across the state, particularly now, with Medicaid eligibility changing and benefits being a lot more comprehensive. The process through ePass or through healthcare.gov can often be confusing for folks, particularly with estimating your income and different family qualifications that make that eligibility a little confusing for folks. So we try to let folks know about our services. We can answer any basic questions that folks have, whether they're just basic qualifying questions or something more in depth, like walking folks through their options from start to finish, helping them see what options are available and letting them know all benefits that are available to them. Whether that's referring folks to the enrollment broker, whether that's seeing different services that are available. Really, a navigator and a certified application counselor are the best ways to see what benefits are available to you, particularly for individuals who maybe it's their first time enrolling. This process can be confusing. So try to let folks know about all their options and get them connected to quality coverage.
Thank you, Nick. April, could you tell us about getting help from a certified application counselor at a community health center?
Sure. So many of the community health centers across the state, they have certified application counselors or CACs at their health center. And CACs operate very much like a navigator. So both CACs and navigators can help people apply for coverage for Medicaid or through the marketplace. And like Nick says, the process can be confusing. So having someone to walk you through the application can be very, very helpful. These people are trained to do that. I will say health centers, they do provide primary care and many other sorts of health services to people, regardless of their insurance status, regardless of their ability to pay, regardless of their immigration status. So health centers represent a very important part of the safety net in the state. And being able to sit down with someone and walk them through the application for Medicaid coverage or coverage through the marketplace is just an additional way that health centers serve their communities. So if anyone is in need of application assistance, they can call the number that Hollis referenced earlier, the 855-733-3711 number. They can also contact their local community health center and ask for application assistance there.
Yeah, and one thing I'll add on to what April said is that whether somebody wants help from a navigator or a CAC, the local health center, they call the 855 number, they'll be connected to either one. So we work closely together, and there's a lot of overlap between what CACs and navigators do. They essentially are able to help with the exact same things. There's just a small difference in the qualification because of CMS terminology, but for all intents and purposes, CACs and navigators are the same. They're enrollment assisters who can help all the way through the process, whether that's for healthcare.gov coverage or for Medicaid coverage through expansion.
And we'll also be providing information in our show notes about how to get in touch with a navigator or a certified application counselor if you or someone you know would like help applying for Medicaid. Now that we know more about how to enroll and who can help you enroll, can you tell us about what kind of industries or jobs or other backgrounds that someone who may be eligible for Medicaid expansion is likely to come from?
Yeah, so we see a lot of folks who are part-time workers with variable incomes, whether that's they work in the tourist industry or restaurant industries, or a whole host of different types of work. I think particularly one of the things that we see often is those individuals who do have variable incomes. It's oftentimes hard for them to predict their income, and that's one thing that navigators and certified application counselors can do. One question on particularly the healthcare.gov application that asks about income, and it asks for monthly income. One thing that we always try to stress is that it is still MAGI income or modified adjusted gross income. So if somebody has variable income throughout the year and it's hard to predict, or if the next month's income is zero, just take the average of the entire year divided by 12 to find that monthly income. But as far as the folks who we're seeing, a lot of times they do have variable income. They also, it's harder to predict their income. One of the things that we're seeing is that there's so many folks who are in rural areas who are harder to reach, who many times, are folks who we've told for the past 10 years that, since North Carolina hasn't expanded Medicaid, then they're not eligible for Medicaid or healthcare.gov coverage if they fall below 100% of the federal poverty level. So, there's also that, folks across the state who have been told no consistently, who are trying to come back to and say, Medicaid has changed in North Carolina. Come back, re-explore your options. We're here to help.
Right, that's such a good point. One of the messages we really want to get across is that if you've ever been told that you don't make enough money to get help from the marketplace and fell into the Medicaid or coverage gap, to come back and reapply because you very well may be eligible for Medicaid now under expansion. Hollis, I know you also had information you wanted to share about who we're thinking are going to be likely to be eligible for Medicaid. Could you tell us about that?
Some of the folks that we expect to be eligible under expansion are coming from, critical service industry jobs. So folks in industries like childcare, home health care, retail, or grocery stores. They currently have pretty high rates of uninsured workers with annual incomes that fall right around the 138% of the federal poverty level. So we're expecting a lot of folks who are in these industries to qualify for Medicaid. We also know, of course, that these folks in these income ranges are going to be represented all across North Carolina. They're overrepresented in rural counties, but of course they represent all races, and a majority of these folks are under the age of 40. So I think there is an additional education piece, helping folks understand the difference between Medicaid and Medicare. In early outreach, we've heard some confusion of people thinking they're not old enough to qualify for Medicaid because they had gotten that confused with Medicare. So just a lot of education efforts and targeted marketing that even if you are working part-time or full-time, if your income is within this range, if you're between 19 and 64, you can qualify for expanded Medicaid.
So Hollis mentioned one misconception about sometimes confusing Medicaid and Medicare. What are some other misconceptions we've been hearing about Medicaid expansion?
So one of the main misconceptions I've been hearing about Medicaid expansion is a concern about assets. So folks think, I own my car, then I don't qualify for Medicaid, or I own my home, I don't think I can qualify for Medicaid. And this is rooted in the fact that there are other Medicaid programs, like Medicaid for the aged, blind, and disabled, that have what we call an asset test. So they assess, any property that you own, how much money you have in your savings account, that sort of thing, to determine if you're eligible for those programs. So when people are hearing Medicaid, they're associating it with that asset test for other programs. But with expanded Medicaid, there is no asset limit. So they're looking at your income, they're looking at your North Carolina residency, looking at your immigration status and your age, but otherwise owning a home or a car does not prevent you from being eligible for expanded Medicaid.
I think another misconception about Medicaid is that it doesn't provide comprehensive health coverage. And the individuals who are newly eligible for Medicaid since expansion, I think it's really important for them to know that Medicaid covers primary care, hospital services, maternity, and postpartum care. And one of the great things about the postpartum Medicaid coverage in North Carolina is that individuals who give birth and are on Medicaid are able to have postpartum coverage for 12 months after giving birth. So that's a really great thing that North Carolina is doing. Medicaid recipients under expansion are also able to have vision and hearing services covered, prescription drug benefits, dental coverage, which I know is very important to a lot of people, and also behavioral health and some other services. So I think it's really important for folks to know that Medicaid really does cover a lot of different health services.
To add on to what April said, that's one thing that we see when we talk to folks. I think individuals who are newly eligible for Medicaid now often think about the old Medicaid coverage and eligibility. So they think it's almost a downgrade, particularly those folks who were eligible for marketplace coverage before. There's those individuals who are between 100% and 138% of the federal poverty level who had marketplace coverage in the past, but are now going to be eligible for Medicaid. And they sometimes see it as a downgrade initially. But once we explain the benefits, that there are $4 copays, there's no premium, it is full comprehensive coverage, folks get excited knowing that it is full coverage, knowing that the eligibility a lot easier now than it was, and that it is full coverage for them and their family. Once we explain those benefits to them, we often hear and see a change in their tone and their expression during those appointments.
Yeah, it's always great to be able to tell someone they're eligible for health coverage, especially the type of comprehensive coverage that Medicaid provides. I know that I have also heard a concern around people not being able to find a medical provider or to keep their current provider if they have Medicaid. April, can you speak on that a little bit?
I have heard that as well. And I will say that I do think there have been issues with provider networks. I will also say that there are resources available to help people identify the Medicaid plan that would be best for them. So the state works with what they call an enrollment broker. And essentially, this is not a person, it is an entity. And the enrollment broker can actually help people look at the different plan options that are available to them through Medicaid and help them identify the one that will allow them to hopefully continue seeing their preferred providers. Also, really important things to consider for people who are approved for Medicaid and are at that point where where they have a choice that can be made about which plan and which primary care provider they want to be assigned to. In addition to preferred providers, it's important to think about which of the plans covers their prescriptions that they take, as well as things like, which hospital is in network and which hospital is closest to them and would they prefer going to. So there is support available to people who are approved for Medicaid and need some assistance figuring out which of the Medicaid plans they want to enroll in.
Another concern I've seen come up is around families with mixed status. So that's a family where maybe the children might be U.S. citizens or legal permanent residents, but the parents might be undocumented. And because of that, they think that they can apply for Medicaid for their children. What is the truth around that?
Really, the thing to underline here is that we don't want to discourage anybody from applying for Medicaid. So even if a parent has a status that would make them ineligible for Medicaid, they absolutely have the right to apply on the behalf of their child. One thing that we really want to note is that any information that is shared on the application for Medicaid that is secure, that is private, they're not going to use that for other purposes outside of determining Medicaid eligibility. I will also say that as a parent applying for your child, you do not have to provide a social security number or even an I-10, individual taxpayer identification number. That is not required that you have either of those things in order to fill out the application on behalf of your children. Another misconception I've been hearing is that if folks have previously been incarcerated or have certain charges on their record that they're not eligible for Medicaid. I think this misconception comes because for other benefits like food and nutrition services or SNAP, there is they check about your record. If you have criminal charges, you might not qualify for those services, but that is not the case with Medicaid. So for no reason should you be denied Medicaid based on a history of incarceration. Another misconception that we're hearing, again, because of the structure of Medicaid previously, is that you can't enroll if you don't have kids. So prior to expansion, the main pathway for adults between 19 and 64 that did not have disabilities was Medicaid for parents and caretakers. If you were a parent or a caretaker of a tax dependent under the age of 19, folks were able to enroll in Medicaid at a certain income limit, but that is no longer the case. So even folks that do not have dependent children can enroll in Medicaid. Again, folks between 19 and 64, up to 138% of the federal poverty level can qualify for expanded Medicaid. Of course, there are the residency and immigration requirements, but there is no requirement that you have dependent children to be on Medicaid.
Another point that I wanted to clarify, I don't know that it's a widespread misconception, but I did want to mention it. For individuals who have been to their community health centers for care and perhaps were uninsured in the past and now are able to connect to Medicaid coverage, they can continue to go to their community health center for care. Community health centers, they serve people who are uninsured, who have coverage through Medicaid, Medicare, as well as other third-party health insurance, like through the marketplace or through a job. So I definitely wanted to make sure to mention that anybody who has gone to a community health center for care can continue doing so, even if they get coverage through Medicaid.
Right, and community health centers are a great place to get your care as well. Actually, I know that community health centers are being impacted quite a bit in a good way by Medicaid expansion. April, what can you tell us about that?
Yeah, it has had an enormous impact. So community health centers receive the bulk of their funding through the federal government. And what this funding allows health centers to do is to be able to provide primary care and other healthcare services to uninsured individuals and individuals who need to pay for services on a sliding fee scale. Medicaid expansion, by providing people who were formerly uninsured and connecting them to Medicaid, that increases the number of insured patients that community health centers serve, which then allows the community health centers to take those federal dollars that, again, are used to provide care to people who are uninsured. It allows them to either see more patients, it allows them to expand the sites that they have, and or it allows them to expand the services that they're able to offer to all of their patients. So it really is such a win-win for the health centers, for the patients that they serve, and just for the communities in general.
And that is a perfect segue to our next topic, which is how do you all feel that Medicaid expansion will impact health equity in North Carolina?
I think the bottom line is that Medicaid expansion will make North Carolina healthier. We know that when folks have access to affordable and quality healthcare, that they do become healthier. These individuals in between 0 and 138% of the federal poverty level are already, marginalized in a way just by being lower income. And we also know that a lot of groups that face additional barriers, people in rural areas, BIPOC individuals, folks that speak languages other than English, all of those, there's discrimination sort of baked into the healthcare system. So Medicaid expansion and providing, like I said, affordable access to healthcare is the first step in eliminating some of those barriers and making North Carolina more equitable.
Yeah, absolutely. And just to add to what Hollis said, that's 600,000 new folks are going to have full comprehensive coverage because of Medicaid expansion that wouldn't have had it before. Just 2 years ago, North Carolina's uninsured rate was about 9.5%. So that'll cut that rate dramatically once we put in the legwork and make sure that all 600,000 of those North Carolinians are aware of their new benefits and their new coverage, and we get them covered and on the rolls. That'll do a lot in increasing health equity across the state.
And I will also highlight the formerly incarcerated population. Medicaid expansion is really going to be a game changer for a lot of people who leave incarceration. Many of these individuals are in need of behavioral health care when they leave incarceration. And until expansion happened, many of these individuals did not qualify for quality, affordable health coverage. So Medicaid expansion is going to make it much easier for them to be able to enroll in affordable coverage so they can leave incarceration and connect to coverage and be able to start accessing health services after they have left incarceration, and just put them in a better position of being able to restart their lives and stay healthy.
Absolutely, April. That is such an important population that really hadn't been reached before by many other options for health coverage. Medicaid expansion is a great opportunity for someone that's been incarcerated, especially if they have been recently incarcerated, to access needed health care, like you said. There's also one more group I wanted to discuss, and that's people who are or were enrolled in Medicaid family planning. What do they need to know about Medicaid expansion?
So if anybody was on family planning Medicaid in the past, leading up to Medicaid expansion and still had those benefits, they were automatically enrolled in Medicaid through expansion or full Medicaid coverage. So we know that affected about 270,000 North Carolinians. So we have heard that there are some folks who had family planning Medicaid were rolled into full Medicaid benefits on December 1 who aren't aware. We've been trying to shout that from the rooftops that if anybody has been helping clients that may affect, let them know to check their coverage, see if that's gone through smoothly. Particularly if they haven't received any information via mail, they may need to update their information through ePass, so make sure that they get the most current up-to-date information through the state. Again, trying to shout that from the rooftops and let everybody know that if they were in family planning Medicaid before, most of those folks up to 138% of the federal poverty level should have, by this point, full Medicaid benefits. There will be some folks who are in family planning Medicaid who won't have full Medicaid benefits, but those are only folks who are above 138% of the federal poverty level.
So now that we've talked about all the great opportunities that Medicaid expansion is bringing, if someone wants to get involved with either spreading the word about expansion or maybe even wanting to help people enroll, what's the best way for them to do that?
Yeah, absolutely. So I think one of the ways that folks can get involved is by contacting any one of our organizations to get included in the partner email list, get included in the Medicaid expansion regional trainings that are coming up. Also, the sign up form on NCDHHS's website. If you Google Medicaid expansion and then NCDHHS, there's a link that says under the heading about halfway through the page, it says stay informed to make a difference, get updates, and volunteer. If you sign up on that form, that's a good way to get updates from the state and from any one of our organizations as well.
There are also opportunities for organizations to become what are known as Certified Application Counselor Designated Organizations, or CDOs. It's a mouthful. This is a program that is offered through the Centers for Medicare and Medicaid Services, which is a federal agency. The window to become a CDO organization closed in mid-January, so that opportunity likely won't open again until later this year. So if an organization isn't already a Certified Application Counselor Designated Organization, or CDO, and they want to have some of their staff or volunteers trained to be able to help people apply for Medicaid, the best opportunity at this point would be to reach out to the Navigator Consortium to ask about volunteer navigator opportunities. But again, once the window opens up again for organizations to become CDOs, I definitely recommend looking into that and seeing if that is a good fit for your organization to allow your staff and volunteers to become certified application counselors.
And Hollis, can you tell us about what CareShare is doing that people can get involved with if they're interested in learning more about Medicaid expansion?
Absolutely. CareShare is dedicated to making the expansion process as successful as possible in North Carolina, and we're doing a lot of work with different organizations to support and equip them with the resources to help their communities navigate the expansion process. One of these opportunities, they're called partner engagement sessions. So we give different organizations the opportunity to come together and just share how has expansion been going for them, any challenges they're experiencing, concerns they have, and sort of troubleshoot that with other organizations doing similar work. It's also a place to share successes and take stock of where we're at right now, because so much amazing progress has been made already towards connecting more North Carolinians to health coverage through Medicaid expansion. CareShare also hosts monthly webinars as part of our webinar series. All of these webinars will feature subject matter experts discussing different considerations for outreach, enrollment, or education as it relates to Medicaid expansion. That's another great way to get involved. And lastly, as Nick highlighted earlier, the three of our organizations, CareShare Health Alliance, the North Carolina Community Health Center Association, and the North Carolina Navigator Consortium, are collaborating to offer Medicaid expansion regional trainings. So these will be offered in person in each of the 6 managed care regions of North Carolina, and they are an opportunity for anyone to learn about, what is Medicaid expansion, how will this impact my community, and how can I get involved. There is no prior experience necessary when it comes to Medicaid. The trainings are free to attend, and we welcome anybody from sort of any organization or industry who wants to learn more to join those.
So if anyone is interested in registering for those opportunities, we'll also have links in the show notes for those. This has been such an informative conversation. I want to thank you three for taking the time to be with us today and to continue to spread the word about Medicaid expansion and all of the work that you're doing to help people get enrolled. Before we go, do you have any last thoughts you'd like to leave our listeners with?
I'd like to just add that, we've mentioned that 600,000 people approximately became newly eligible for Medicaid once expansion launched on December 1st. The most recent numbers that I've heard from NC Medicaid is I think approximately about 315,000 or so of those 600,000 individuals have been connected to Medicaid under expansion. So that still leaves close to 300,000 people that still need to be reached and may need help applying for coverage. So there really is still a lot of people to be reached, but also a lot of work and a lot of need for enrollment assisters, which include navigators and certified application counselors, to get out in their communities and reach those folks who still need to be connected to Medicaid. And I know our three organizations talk frequently about how enrolling all the people who became newly eligible under expansion isn't going to happen overnight. And I know our three organizations have a plan to work together on just this one effort for the next 2 years, because we do know that it is going to take a while to reach all of those individuals.
You're so right about that, April. There are hundreds of thousands of people who haven't yet been connected to the coverage that they're entitled to, and it's a big effort to reach all of them, and everybody can get involved with it. We've mentioned a few of those ways earlier on in the episode, but also just spreading awareness in your communities is equally important. I think the North Carolina Department of Health and Human Services has toolkits with all kinds of promotional materials for Medicaid expansion. They've offered trainings for people to become equipped to go out in their communities and give presentations about the basics to spread awareness. It's definitely an all hands on deck effort to get the word out and to make sure that everyone who is eligible for this coverage gets enrolled.
Yeah, I'd just like to say, if you're a partner organization listening to this thinking, can we really help? I think the answer is absolutely yes. We are strong believers that partner organizations have the biggest foothold in the community. You talk to folks every day who are going to be affected by Medicaid through expansion. And this is a collective effort to make sure that everybody across the state who's now eligible for Medicaid through expansion is aware of the new benefits that they're entitled to. So please connect with us. Let us know if you have any questions on how to best get that message out. If you want more details on what that message is, we are happy to work with anybody across the state who helps us reach that goal of maximizing coverage and getting people connected to the benefits that they deserve.
Absolutely. I'll just echo that. Aaron, I love how you phrased it. This is an all hands on deck effort. Folks in all 100 counties of North Carolina are eligible for Medicaid expansion. And we really encourage, if you're listening, even if you don't typically work in the Medicaid space, so be it you're in the food world or the transportation world, I think any opportunity for engagement, if you're on the ground working with folks that may be eligible for expansion, that is an opportunity to share information about how they can apply, the resources available to them is going to be a game changer, because sometimes we need to hear it 2, 3, 4, 5 times before we take action on something. But we believe that together we can get these 600,000 North Carolinians connected to the health coverage they deserve.
Thank you so much for listening to this episode of the Equity Plus podcast. Special thanks again to our guests Nick Riggs, April Morgan, and Hollis Smith for sharing their knowledge and expertise with us today. Part of the reason for today's episode is that our three organizations are working collaboratively through the next 2 years to help more North Carolinians become aware of Medicaid expansion and what opportunities there are to enroll or to help others enroll. Our work is being generously supported by combined funding from the Kate B. Reynolds Charitable Trust, the Duke Endowment, Dogwood Health Trust, the Cone Health Foundation, and the John Rex Endowment. As I mentioned during the episode, more information about our work will be available in the show notes. If you're listening and want to get involved, we would love to hear from you. If you enjoyed today's episode, don't forget to subscribe to hear more from community leaders and community-based organizations in North Carolina about how they're working to advance health equity. To learn more about CareShare Health Alliance, visit us at caresharehealth.org, and don't forget to check out our hub for community-based organizations working to promote health equity and community voice, the Equity Plus Network, at equitypn.org. That is EQUITYPN.org. We can't wait to connect with you there.